everybody, it's Dr. Joe, and today I'm going to show you my top 7 treatments for finger and hand pain. So let's get started. Disclaimer alert, disclaimer alert. So the first treatment is just going to be finger taps. This can be anything from arthritis, maybe a slight hand injury, an overuse injury, things like that, where you've just got some aches and pains in the hands and the fingers. So finger taps are as easy as it sounds. It's just tapping the fingers and the thumbs together. So what is really important to do is open up wide each time. So I'm going to start with my thumb and my pinky, and I'm going to come together and then open all the way up. And then I'm just going to move up the fingers and just tap and come back. So you really want to open up that palm every single time. So it's not this, it's coming back open and really closing and making that movement. So when you're doing these, you can just start off with maybe 2 to 3 sets of just going back and forth, like 1 up and 1 down would be 1 set, and then kind of work your way up from there. It just really depends on how much pain you're having, if you had an injury, how long you've had the injury. So it's kind of your judgment of how many you need to do. Then the next one is going to be thumb taps or thumb movements. So you really want to get that thumb joint too. A lot of times when people have that hand finger pain, it's in those deep joints there, especially on the thumb here. So with the thumb, you're going to do it a couple different ways. So now this time, keeping kind of the finger straight, you're just going to bring that thumb all the way over to almost that pinky joint at the hand there, and then come back up. So maybe do that about 5 times. And I have some arthritis in my hands. I've also had surgeries, surgery on both sides of my hands, my left and my right. So I can really feel this stretching my thumb area. And then after that, you're gonna go to here. So you're gonna open up and come down. So just almost like you're a Pac-Man eating it, or like that, up and down. And then the last one for the thumb, I'm going to turn a little sideways so you can see. You're going to come up and then down in that direction. So see, you're kind of moving that joint in all those different directions. And I'm going to turn my hand so you can see where it's kind of going forward and then down. So again, maybe just starting off with 5 reps of each. You can do a couple sets, 2 to 3 times a day. It really just depends on what's going on with your hands and then how's it feeling. So then the next one is going to go into the wrist, because when you're moving the wrist, all those wrist muscles come down into the fingers and the hands. So you really want to get that wrist moving as well. So just make a little fist with your hand. If you want to rest it on a table or the side of a chair so you can have your arm relaxed, you can. If holding it up is comfortable, that's fine. I like bending my elbows. Some people like doing it straight out. It's completely up to you. But all you're going to do with this is just bend it down as far as you comfortably can, and then come back up as far as you comfortably can. This one you can do a continuous motion, just kind of going back and forth. If you want to pause and maybe do like a 3 to 5 second hold at each side, you can just get that little bit of an extra stretch in there. So if you want to do continuously, I'd say maybe start off with like 10 reps and then work your way up several times a day. And if you want to do like a little hold with that 3 to 5 seconds, maybe do 5 each way, just so you're not overworking that wrist. This is really just kind of loosen everything up, get that pain out of there. So then the next one is going to be massaging the hand. So it's really important to kind of get the blood flow in there, get the circulation going. Massaging always kind of helps. You can do it a couple different ways. You can start here and just kind of stretch or push the blood flow back, and each finger is kind of going like this. You can also just start at the palm and like do some circular motions here just to kind of get that massage, which is really nice. But you can also use equipment to do the massaging for your hands and the fingers, and there's a lot of great products out there. And the folks at Breo Technology sent me their iPalm 520S hand massager. And this is a really cool thing. You can see it almost looks like a mitten to be able to put your hand in there. And what I really like about this particular one is you can plug it into the wall, or it's also battery powered, so you can put the batteries in there, so then you don't even have to have the cord with you. And what this does is it uses air compression. It's almost like, I'd say like an airbag in there that kind of fills up with air, and then it gives you compression to help increase that circulation. And there's also a heat component in there as well. And if you have arthritis in your hands like I do, you know that feels really, really good. It's a nice component. There's also 3 different settings on there. There's actually 4, I guess, because one is kind of an alternating setting. If you have a lot of sensitivity in your hands, this is very firm pressure. I really like it. It's kind of like a massage, and when you have a massage, if it's not a whole lot of pressure, not really getting much benefit out of the massage. So if you have some sensitivity to your hands and you don't really like a lot of pressure and things, this might not be quite for you. You can see here I've had a hand surgery. It was a long time ago, but I use the lightest setting since I've had surgeries, and it feels good. Lots of pressure, but it feels good. I've also done the highest setting, and I can still tolerate it, but it's just not what I would want to do every time. So the lightest setting works great for me. So you can try all the settings and see. And if it's too much while it's going on, there's a little button here that releases the pressure. So it's not like you just have to sit there and take it. You can release that pressure, or you can just turn it off and start over. And the heat has different settings as well. So that's really cool. Make sure you take your jewelry off when you're doing it. Don't put the jewelry in there. But all you do is you just kind of set it in. It's got some grooves in there that you can kind of feel where you want to set your hand. There's kind of a little square in there where you want to put the palm of your hand in there. And you want to go in this way. You don't want to go this way, because there's also little acupressure points, like those little dots that you feel that puts that pressure on there. So once you take your hand back out, you're going to have little dots on your hand. That's completely normal. That's a part of it. That's that acupressure, and just it'll go away after 5 to 10 minutes. There's a timer setting as well, which is also really nice. I'm going to turn it on just for a little bit so you can kind of hear and see what's going on. But again, what's really cool about it is you can just kind of, as you go, change the settings. And so you kind of hear that. But what's nice again is it's pretty portable. So I can just hold it in my lap. If I'm working on the computer, I can set it on the side and still do my work. I can kind of hold it up in the air like that. You probably don't want to. You want it to sit nice. But so you can see here, it comes up, and then it goes down a little bit, and then you feel this like rolling sensation where it goes onto your fingers as well. So it's the nice combination. There's one that's goes up and down, and I like that. And again, if you feel like it's too much, maybe right there was a little bit too much for me, I can press this button and you can hear how the air comes out. So it's a really, really cool product. I like it. It does a great job of getting that comfort into your hand and get that increased circulation by pressure. And you can see those little bit of dots right there. But again, that's completely normal, and that'll go away as you go. So if you're interested in purchasing the iPalm 520S, make sure and click on the link up there. So the next treatment is just a full finger stretch at the joints. And so again, this one's a pretty firm kind of pressure, so just use whatever is comfortable for you. So this time what I'm going to do is I'm going to take my whole finger and just gently pull it back this way. So if you want to set it on a table or on your hand and just pull back like that, you can. That just gives some nice stretch on the inside there and just stretches everything out. Since this is a stretch, you want to hold it a little bit longer. I wouldn't say you necessarily have to do a full 30-second stretch since it's a smaller finger, but maybe like a 10 to 15-second hold. So just really getting that nice stretch in there, and then go all the way up and down your fingers. So you want to do all your fingers, and you want to do your thumb as well. So just getting that nice stretch in there, pulling it up, but just to comfort. Don't get to where it's pain in there. This right now is when I'm pulling up, I get that nice kind of stretchy, burny feeling, but there's no pain in there, and so that's nice. So just kind of going through all those joints, and that's going to get closer to the hand and the finger joint right there. So that's also really nice. So then the next one, going into some exercises, is you can just take a towel and roll up the towel. You can use a tennis ball. You can use a lacrosse ball. Usually those are a little bit firmer than I like, but if you like that, that's fine. Because all you're doing is just kind of getting something that you can squeeze on. And it's just like it sounds. I call it a towel squeeze. And so you're just squeezing that towel, getting that, starting to work those muscles in there. And then, so this one I'd say is probably maybe a 5-second hold. So just holding, giving it a good squeeze for that 5 seconds and then relaxing. So you don't want to squeeze so hard that you're going to make your hands hurt. So if you want to, when you're first starting off, maybe just do 20 to 30% of what you feel like you can do and then kind of work your way up. But just maybe do 5 to 10 of each of those. And then the last one is then going to exercise going into the extension motion. So that one was the flexion motion. This one's going into extension. So you can just take a rubber band. It doesn't have to be a fancy rubber band. It can even be one that you get off the newspaper if you still get the newspaper. But you're going to wrap it around the tips of your finger. Try and make sure to get it low enough so it doesn't pop back out on you. But your fingers are going to be together like this, and then you're just going to open them up as far as you comfortably can. So you can see I'm not going all the way open, but the key is when you come back, go nice and slow. So I'm not just doing that. That's not really working those muscles, but really controlling it, especially coming back in. So since you're doing an exercise with some resistance with this, I would just start off with maybe 1 to 2 sets a couple times a day, and then you can kind of work your way up from there just to make sure that you're getting the exercises in the fingers and the hands. So if you have, some tightness, some pain, some uncomfortableness, that'll help make it stronger, as well as getting all that pain out of there. So there you have it. Those were my top 7 treatments for finger and hand pain. If you're interested in purchasing the Breo iPalm 520S hand massager, make sure and click on the link up there. And don't forget to subscribe by clicking down there. And remember, be safe, have fun, and I hope you feel better soon.